So for those not familiar with the question or the concept, often when folks have had strokes, one of the residual effects in trying to walk is an inability to appropriately raise the ankle as we swing the weaker leg through to approach the heel onto the ground in front of us. This is often referred to as foot drop. The training can be done in one of two ways. First stationary, and then in a truly functional context. By stationary, I mean sitting and then progressively moving one's body into a standing position, because we don't walk sitting. We have to be able to change the length of all of the muscles of our lower extremity to be positioned as they should be when we're trying to raise our ankle up as we walk. So to practice trying to increase the motion of the ankle becomes very important. A robotic is very valuable here because sometimes patients can't appreciate how much they're moving relative to how much they should move to successfully clear the floor or the ground once they're going to be walking. And the other thing they're not often sure of is the directionality, the angulation of the entire ankle. Sometimes when we think of walking, we don't think about the total position. You just can't raise your ankle up and make believe this is my ankle for a moment. You just can't raise the ankle straight up because the ankle doesn't typically move that way. The ankle often moves up and rotates in, moving called dorsiflexion and inversion. That's what we over-exaggerate when we're trying to relearn to move. We need to relearn not just raising the ankle up, but to control the out or the eversion component so we can come down on a flat heel, not an inverted foot. So in a sitting to standing position, the therapist can advise the patient, even guide them to some extent so they can begin to reappreciate the directionality in which they should move. But often patients can't appreciate the range of motion or don't have the motion. That's where a robotic can become very handy. If one is positioned into a device that allows controlled motion of the ankle and give information back about how much the ankle has moved, the directionality, the speed at which this can be done, and retrain the ankle to move in the appropriate direction. Once again, with multiple repetitions, so the patient begins to reacquire the sense of appropriate angulation and direction. That's key to success. That's just in the stationary position. But that's not how we walk. Now one has to integrate the totality of the movement of each lower extremity as we progress forward. So the challenge then becomes, can you take what you've done in a sitting to standing position and now interface that into the actual progression of the entire leg as one moves forward? And that can be done in stages as well, even to the point where the therapists assist the patient by temporarily holding the limb as the patient's going through the motion to recreate what they were doing in a sitting to standing position as they move the limb forward.